Well, Rena, what we heard today is a lot of times these nursing homes and other long-term care facilities, so-called congregate living facilities, will reach out to their local authorities first and then consult the state when it gets really bad. So that's when the state brings in things like rapid response teams and nurse case managers, and all in response to what is really a sad reality about where these deaths have been concentrated so far. Currently, long-term care facilities account for 19% of all coronavirus infections in Minnesota, but 70% of all deaths from the virus.
So each facility that has an outbreak is assigned to a nurse case manager. And the nurse case manager works with them daily in identifying ongoing issues.
The state won't say where cases have been more concentrated, but the CARE I-Team review of death certificates shows the highest number of deaths linked to COVID so far is 10 at St. Therese in New Hope. The I-Team's research also found another center down the road, Northridge Health and Rehabilitation, has 6 deaths so far.
Even as we implement the things we thought we would need to do, we're learning about more things that we can do to make our response better.
Health officials concede the uneven availability of testing can also affect the numbers, which is why precautions remain so important.
Very likely, in all of these situations, that transmission is coming in from the community. And obviously, we made recommendations fairly early on about visitor restrictions.
We've heard about the visitor restrictions, people not being able to see loved ones, and also about the training that's been going on to make sure that people know how to disinfect surfaces and things like that. But in the meantime, we did today, Rena, get a glimmer of hope, or a big hint, you might say, that we may have more big developments on the testing front soon. In fact, a system to coordinate the testing so it really goes to where it needs to go instead of being kind of a quilt work pattern as it is now. Back to you.
All right, that is good news. Thank you, John.